Moisturize. Moisture replenishes what your baby's skin loses and gives your child a protective barrier. So you want to do this on a regular basis, usually morning and evening. Regardless of which moisturizer you use, always choose fragrance-free, as fragrances are one of the leading allergens. Cleanse. We know that babies are not that dirty, but you still want to follow a regular nighttime bath routine. Not only is this calming for your baby, but you also wash away oils and excess dry skin that can lead to Cradle Cap and other skin conditions. Treat. Your baby's skin is sensitive and delicate, so when unwanted conditions and irritations occur, know your treatment options that include rashes, Cradle Cap, and even sunburns.
Thank you for staying tuned. This is the Skin Therapy Show. I'm your host, Sarah Niteshna, and I'm still here with Mrs. Josie Karaoke and Samson. Josie, you've just mentioned something very important, which is the Cradle Cap. And I have a friend of mine who sent me specifically to you. She's a young mother, and her newborn has Cradle Cap, and she doesn't know how to deal with this. What would you recommend for her to do?
Okay, Cradle Cap is like a thin, scaly crust. A layer that forms on top of the scalp, and especially because most babies are born with very little hair, so it's very noticeable. And which is why, like your friend being a first-time mom, she would be so worried about it. It's something that actually finishes on its own. The baby literally outgrows it and the scalp clears. But I also recommend for mothers who are really worried about it to use olive oil. I recommend olive oil on the scalp. I wouldn't recommend it on the rest of the skin. On the scalp, because olive oil is a penetrating oil. So it will help to break down that crust and it will just fall off. There's no need to peel it off. There's no need to comb it off. So it's just a matter of using the olive oil, gently massaging it, and just doing that every day. And eventually it will pass on its own.
Right.
But it's interesting also, the doctor was telling me about one of the other reasons why it can be caused.
Tell us, Samson.
A majority of the babies with Cradle Cap, actually, we are not able to establish a cause. The cause is unknown. But it's also been shown that excessive application of oils can also cause that. Yeah, it's a paradox that also in the management of it, actually, you're using baby oil.
Exactly.
But we've seen mothers who come and they think it's a fungal infection. They apply antifungal creams and it doesn't go away. So it's not a fungal infection. So as Josie says, olive oil, within 1 year, it clears. So just give it time. Don't peel. Give it time.
So it is nothing to worry about.
Nothing to worry about, yeah.
All right, okay. Yes. So what about the umbilical cord? How do we clean it, Samson?
The current recommendation of the Ministry of Health is that we use Chlorhexidine. This is an antiseptic that has been shown to minimize the colonization of bacteria around the cord and also very friendly to the skin. But unfortunately, it's out of stock in the whole country.
Oh, really?
Yeah, it's
That's
out of stock. So probably before that, we're still using the spirit, the spirit swabs. But this is also an area that we still find also others recommending just use of dry cotton or with some water. But the main thing is that even if you use cotton and water, then keep the place very dry.
Very dry.
Yeah. So probably if once the Chlorhexidine is available, then that is the number one recommended.
Okay.
Yes.
It is just very sad to hear that you know it is missing in the whole country. That's just bad. Josie, do we treat the umbilical cord as a wound?
Yes, you would. And that is why, as the doctor said, you have to make sure that it is dry and that, and which is why also they would recommend that you use the spirit or the product is just to keep it dry. And you might find, but what it's not is painful. You tend to find, they cry because of the cold from the spirit. But painful, not necessarily.
Not necessarily.
Yes,
It doesn't have pain receptors around there. So it's not painful.
It is not
Not painful, yeah.
Something that's important for the mothers to remember is that they should not be afraid of cleaning the cord, around the cord especially, because the baby crying is not pain, like the doctor said. It's simply because they are reacting to the cold of it. And like doctor, you've mentioned, and the best way to clean the cord?
Yeah, we normally advise that you use the spirit swabs.
Okay.
You take them into 3 portions.
All right.
Once you wipe, you discard. You don't use one all around. Just wipe every part as you discard. Yes.
Apart from the cleaning procedure, how else does one keep the umbilical very safe from, from bacteria or whatever kind of infection that a baby can get?
Of course, number one is that ensuring that it's clean, and this mother should be very keen to observe for any signs of infection, which include a foul smell or a pus around there, or just reddening of the skin around. And the other thing we advise mothers is that you should not put the cord under so much pressure with the diaper, so that it is not complete, it's not pressed, so that there's a good air circulation around that place, which helps the cords to heal. And most of the times, within 1 week to 10 days, the cords should have detached.
Josie, how does a mother know that the cord is about to fall off?
Well, it continues to dry, and then one day you'll just find you're going to change your baby and the cord is literally has fallen off and it's dry. And some mothers keep it as a keepsake, that small piece that has fallen off.
All right, all right. Before I get your final thoughts on today's episode, I have one more question to ask you. Most of the mothers on our social media pages are asking, how does one take care of the baby rash that is caused by the diaper? What is the right procedure to use? Let me throw this to you, Samson.
It's first of all important to know why we get diaper rash. And one cause is just delayed change of the diapers. So delayed change, sometimes putting the diapers too tight, or some babies may just react to certain brands of diapers.
Exactly.
So we recommend one, frequent changing as soon as the baby soils the diaper, let's change it. Also allow for periods of exposure. Just exposure is very helpful. There are also products that your pediatrician can advise, like zinc oxide, which you apply with change of diapers.
Okay.
Yes, yeah.
Okay. And I'm so glad to have you as a pediatrician on the show. I'm going to ask you a question that maybe is a bit off this skin therapy show. I'd like to know, when is the right time to start feeding babies solids? And
Solids?
what does diet have to do with a baby's skin? Is there any relation as it is with the adults?
Talking about complementary feeding, we
Exactly.
recommend 6 months of exclusive breastfeeding. So after 6 months,
6 months.
yes, after 6 months we start. About that point in time is a very sensitive time for the baby's skin, because as you introduce other feeds to the child, then
The
that's the
skin
time
changes.
they may have reactions. So we recommend during that time, as you introduce new foods, for every food that you introduce, observe. That's the best time to observe for any adverse reactions to any foods.
Yeah.
So every feed, observe as you introduce other feeds. So that's a very important point to pick up allergies and such other problems that may
Exactly.
arise. So it's a point also we start seeing allergy to foods, and yes.
Okay, so 6 months of breastfeeding.
Exclusive breastfeeding, yes.
How important is breastfeeding, Josie, in regards to skin care for babies?
It's important in the sense that it's natural and it's what a baby digests easily. It's what was made for the baby.
Yeah.
So you will rarely find that a baby is reacting to breast milk.
Yeah.
Which is why it's so important. One of the other reasons why you're going to breastfeed for the 6 months. I will also add to what he said about complementary feeding. It's just with the introduction of solids, whenever you introduce one type of food, you wait 5 days before you introduce another type of food. And that is where he was talking about. That is when you pick up any adversity to skin, and that's when you see where the allergies are.
Okay.
Yeah.
All right. Your final thoughts before we wind up the show. I am so intrigued in this topic. I just want to go on and on and on and on and on. But unfortunately, time is not on our side. So maybe I can start with the lady.
It's about keeping it natural and simple. If possible, stick to oils that, to put it simply, that you would use for cooking. I had mentioned earlier I would not recommend olive oil for skin use on infants because it's a penetrating oil. So it might start also causing breakdown of the skin. But things like coconut oil, sunflower oil, very good. So keep it natural and simple.
Yeah. All right. Samson?
I want to say that baby skins are sensitive, and whenever you're in doubt, just get in touch with your pediatrician, and consult. Yes, don't make guesses. Consult.
Thank you so much. I feel like I'm now
Yes.
ready to be a mother already. Thank you, and we hope to see you again, Samson. Josie, as always, it is a pleasure having you. We hope that you will come back on our future episodes.
Thank you.
And thank you so much to you, our viewers back at home, for staying tuned. This is a Skin Therapy Show. I have been your host, Saranda Niteshna, and I've been here today with Mrs. Josie Karaoke and the pediatrician, Samson. Thank you. Until next time, let's meet same place, same time next week. Good night.